Well, good morning, everybody, and welcome to Town Talks. I am your host and also your mayor, Renee Morgan, and I welcome all of you here today. You know, we try to find a way to reach out to the community, to keep everybody informed, and to answer questions that you might have. Well, this is our format now. It's called Town Talks, and we're looking forward to having everybody join us once a month, the first Friday in the month. And today is our first show. So today is a powerful hitter. We have some great guests on our show today. We're featuring three very important people in the fight against the COVID-19 pandemic in our area. Their role is very different, but also very important to keep our community safe and informed. They are the heroes in our neighborhoods, and they are going to be giving us the latest updates and ready to answer your questions as well about what the COVID-19, where we're going to be, and when are we getting back to normal. So I'd like to introduce my guests today. First, we have Contra Costa Deputy Health Officer, Dr. Ori Tzvieli. We also have San Ramon Valley Fire Protection District, our Chief, Paige Meyer, and San Ramon Regional Chief Executive Officer, Ann Lucena. So welcome to our show today, and we're excited to hear from you and listen to some of the things that you have to tell us about what's happening with the pandemic. Let's go ahead and first start with our County Health Deputy Health Officer, which is Dr. Ori Tzvieli. Welcome, Dr. Tzvieli. How are you today?
Thank you. Thank you for the invitation. Nice to be here.
It is great to have you here as well. You know, who would have thought? It's almost been a year now since we've been sheltering in place. And it seems like yesterday. I remember being in the store and all the buzz around saying, you know, you better get everything you can. And people were grabbing toilet paper thinking it was going to cure the virus. And, you know, it was interesting because a year ago, I bought a face mask. And I thought, you know, we're going to be wearing this probably for a month and then we'll be done. Who would have thought that I would have been ordering face masks to match outfits? Now, I know, men, you're probably thinking that's a little crazy, but, you know, I probably have about 10 of them now so I can interchange and wash them as well. But given the unprecedented nature of the COVID-19 pandemic and the ever-moving tiers, it's no surprise that we have a lot of questions for you. Would you start by giving us just a brief update of what's going on?
Sure. I'm happy to be here almost a year after the start of the pandemic. I can report that things are, in general, heading in the right direction. Our case numbers are dropping relatively rapidly. We're down to 9.6 cases per 100,000 is our last 7-day average, which is still in the purple tier, but I think if the trends continue, I think within a couple of weeks, we should be in the red tier. So that's good news. The percent of the tests that are positive is also continuing to go down. We're down to about 3%. The average number of people in the hospital is about 70%. That's all the hospitals throughout the county. I'm sorry, not percent, 70 people total. The testing remains widely available with good turnaround times. Most tests are coming back in 1 to 2 days, and we're still doing over 5,000 tests a day in our county. The vaccine effort is also going strong. We vaccinated about a quarter of the population of Contra Costa County already, and about half of them, about 12%, have gotten both doses, so they're fully vaccinated. The others are sort of in midstream, have gotten 1 dose, but are still waiting for the second. That's 343,000 doses that we have given, and we're on track to meet our goal of 1 million doses before the 4th of July, before Independence Day. So that's good. The county and its affiliated partners have been the #1 vaccinator in the county with over 100,000 doses given. Number 2 is Kaiser, number 3 is John Muir, and then the pharmacy partners that have helped out with the nursing homes. I can tell you that Danville specifically is slightly beating the average. So 34% of Danville's population has been vaccinated, and half of them have had both doses. And we've also made a lot of headway vaccinating our elderly population in particular. Over 88% of the 75 and over have been vaccinated in Contra Costa County, and over 64% of the 65 to 74-year-old age group. So that leads the Bay Area in both of those categories as well. And I can say that we are the #1 large county in California as far as getting vaccine doses out. So very happy for all of our partners, including our fire partners. The other good news this week is that in addition to the Moderna and Pfizer vaccines that we've had for a couple of months, we now have approval of the new Johnson & Johnson vaccine, also called Janssen or Janssen, pronounced Janssen. It's a European company that Johnson & Johnson bought a few years back. Anyway, that's a nice vaccine because it's a 1 dose and you're done vaccine, and it's a little bit easier to store and administer. It doesn't need that deep freeze. It can be stored in the refrigerator for up to 3 months, and that gives us more options, particularly reaching hard to reach populations where you're not sure if you're going to see the people back. So, and also it will help our hospitals. Our hospitals are now all either already discharging patients with the vaccine, so they give them a vaccine before they discharge them, or making active plans to do that. So this Johnson & Johnson vaccine is going to be helpful for that as well. I think I'll stop there. That's sort of the big broad stroke update. I'll just say one thing: people are worried about variants, and they're hearing a lot about variants, and that's sort of the big unknown that remains. We know our vaccine is amazing. It really is life-saving. It works against the variants that we have circulating in our country right now. But the fear is over time that more variants will develop, particularly in unvaccinated areas around the world, and that more, and one of these variants may be resistant to the protection offered by the vaccine. We haven't seen that happen yet, but that's what all of us in the public health world are sort of worried about. I know all the vaccine companies are working on potential booster shots, if that should happen, that would cover the emerging variants. We don't need that yet. It's just something we're keeping an eye on. So that's sort of the thing that's keeping us a little more cautious, but in general, we're really happy. We think we're in the right direction. We feel that by summertime, anyone who wants a vaccine should be able to get one. The vaccine supply is expected to increase significantly in the second half of April and going into May. So very happy about that. It's, we're sort of in this really difficult in-between period because all of us who've gotten vaccinated are ready to take the masks off and gather again and go into restaurants again. We're not quite there yet. We need a little more of our community to get that immunity, but it's coming. So very happy about that.
You talked about a variance, and pre-pandemic, I'm out in the public quite a bit, and I'm shaking a lot of hands and meeting a lot of people, and I'm very adamant about getting my flu shot. And some years they say it's a hit and miss. There's some years I've gotten a flu shot and I've still got the flu. Is that something that's the same with this particular vaccine that people are getting as well?
It is, but the flu mutates a lot faster than the coronavirus. So it changes so fast that it is much more of a hit or miss. The coronavirus does mutate, but it's slower than the flu. But because there's so much of it out there, then that's when there's a risk for variants. So if the faster we can get the whole world actually vaccinated, we would reduce the risk of those variants developing. So it is like the flu, but just not as fast. And I think we'll get a handle on it. I do feel like it could be that we'll need booster shots for one year, maybe 2 years. I don't think it's going to be an every year type of thing like the flu shot. I think that once the vaccine makes its way through the world population, we'll be in much better shape.
So what about unused doses? I understand that some of them are going. What's the county's procedure on that as far as the unused doses?
Yeah, it took us a little while to develop it, but we now have a list of people who are in the tier that we're vaccinating, so either elders or essential workers, and we do try to call them in at the end of the day when we we've opened a vial and we know we don't have enough people coming through to finish that, we try to call those people in. We are not in our size sort of having people line up and hope to get lucky. That we really are trying to do it to people who are within the tier and prevent the chaos of and the unfair things that can happen when people are lining up. So,
you know, and there's also the vaccines have been in short supply, and I understand that the county has had to pull back a little bit and only administer the second dose and not administer the first dose. Do you see with the new drug that's coming out now with the 3 pharmacies, do you see that changing, or are we still in that mode of only doing second doses right now and pulling way back on first doses?
I think we have about 1 more week of that, and I think it will slowly open up more. I think we just got our allocation numbers and we were able to open up some more first doses this week. I think last week it was about 80% second doses. This week it's probably going to be about 70% second doses. So we are getting first doses. I can tell you that Kaiser's been getting more, so they're doing more first doses now. So I really encourage people who are in the tier or essential workers to call Kaiser up. They're vaccinating their members and also non-members. So they're the ones who have a little more capacity right now. It's changed over time. We do hear from the state that they're gonna be moving some more of the vaccine supply to the Central Valley in Southern California, harder hit communities. So I don't think we'll get a lot more numbers quickly. I think it will be in April really when we see that. We are making plans, you know, that this is relevant to you all. We are making a few relevant plans. One is we're gonna open up the San Ramon campus of DVC as a vaccine site. I think this might be the first place I'm talking about that. We won't have a lot of vaccine to start, so it'll be a pretty low volume site to begin with, but it should open on the 15th, and that will be like a Monday through Thursday schedule, 8 to 6 p.m. We'll run longer days there. We're also making more plans for 2 mass vaccination drive-through type locations, one at Waterworld, the second at Antioch BART Station, when we do have enough vaccine to staff those. So we're expecting that to happen end of March, beginning of April. Hopefully we'll have enough vaccine to get that going.
That's great. That's great. That's good news to hear. You know, as a county health officer, you know, you have options to enact stricter restrictions. And I'm just curious, the state requires a certain restriction, our county offers different restrictions and has different restrictions. As Contra Costa moves into the red tier, do you see, or do you anticipate doing this?
No, we don't. We have shifted as our numbers have come down and our community has become, I think, more aware of just the devastation of the pandemic, the early peaks of the pandemic. People sort of know what they need to do at this point, and we feel like it's not particularly helpful for us to be stricter than the state at this point. So we think we're just going to be sticking to the state guidelines and not going above and beyond as far as restrictions are concerned.
I mean, it's just been a fear. You know, we went to a point to where we had restaurants that had, you know, 50% occupancy, and then all of a sudden they went back to nothing again. And I think people have an innate fear that this is going to happen all over again. And do you see that happening, or do you see with the vaccine, we see brighter skies ahead? I mean, what is your thoughts?
I think brighter skies, barring a major variant coming through and taking over, that could happen. I don't see that happening right away. I think, and I'm really hopeful it doesn't happen at all. So I'm cautiously optimistic at this point.
Well, that's good to hear. So why don't we go ahead and move on then right now and open some questions up to our chief of our San Ramon Valley Fire Protection District. And welcome, Paige. We're so happy to have you here today.
Thank you, Mayor. Happy to be here.
So, you know, San Ramon Valley Fire Protection District, under your leadership, has been a full force in trying to make sure that our community stays healthy and making sure that we get the vaccines out there. Can you let me know just a little bit about what you're doing in the community?
Yes, and I digress for a minute. Dr. Tzvieli and County Health have been great in working with us and getting the vaccines to our firefighters. I'm very proud of the fact that our team has and our fire board has made it a priority to get our community, back. And when I say our community, I'm talking about the entire county of Contra Costa. This is a team effort. It's a regional effort. We realize that. The only way we're going to move forward is if we get everybody vaccinated in the county, and that's when we can all move forward, right? So it's been really a very very positive and great partnership. So I appreciate that. So I just want to mention that right off the bat, because early on, there was frustration by everybody. We locked down, everybody's frustrated. Information is scarce, and that's difficult. So we kind of went through our ups and downs, and we created, I think, a partnership and a trust level. And what we saw as the fire district is we saw our call volume go down. And many of you may be aware, we put out a PSA. I know that we had less heart attack patients coming in, stroke patients coming in, but we knew that they weren't going away. I mean, we could understand a reduction in accidents, traffic accidents, because not as many people outside, but we were concerned about getting the information out to folks to call us. So it was difficult, and we still see a little bit of a downturn. We're only about 80% call volume of what we're used to. So as we move forward with the fire board, one of the things we knew was going to happen, and I think that a little bit of foresight from our fire board and our leadership here is we knew that you're going to have vaccinators. And I don't mean this to sound mean-spirited, but we definitely have a sense of entitlement, I think, in the country. Like Ori Tzvieli can drop down from the sky and put a needle in everybody's arm. And if that doesn't happen overnight, then whose fault is it? So for us as the fire district, we knew we were strategically placed in the community. If we stepped up and became vaccinators for the county, we would make their life easier. We wanted to shrink their problem. So right away, we jumped to the front of that and said, hey, you tell us what you need and we'll make it happen. And so that partnership is kind of how we came together, was lower call volume. We don't want a high call volume, obviously, but we want to get back to normal. So we partnered, and we've had, I think, upwards of 20 vaccination clinics or mobile vaccinations where we go out to those that can't get around. That's been very positive for us. We can probably, our capacity, we could do more per week, but again, vaccines are the problem, and Dr. Tzvieli will tell you they'll give us as much as they can if that's available. So it's been very positive because we've seen it, and I'm going to just say this: I've been in this business a long time. I've been on all kinds of accidents and fires and medicals, and it has been such a boost of morale for our district to be involved in this. Because when you give a vaccine, and you have to remember, we're the vaccinators. We don't make a lot of decisions on the top end of who gets the vaccine. We follow what the county tells us to, and they spend a lot of time getting it right. But when we give that vaccine, I've never felt more pride when a grandmother is upset and can finally feel like they're getting back to normal. Yeah. And I get that from everybody. So our role has been vaccinators, and we will continue to do that. But it's been an honor. And I speak on behalf of the district completely, from the firefighters throughout our organization. It's been really a great time for them to be a part of the solution. And we'll continue to do that. And for Dr. Tzvieli, as he said earlier, I just have to speak to this. I think it's very important that people remember, when you give these vaccines to folks, we also have people that don't show up. So we do end up with extra vaccine. And I want to commend the county in giving us guidance, because it was frustrating for me in the first 2 days, because all of a sudden you have extra vaccine, and it's not your fault that somebody talks to somebody and they go, well, I don't think I'm going to go get the vaccine today, right? They change their mind. So we end up with extra vaccine. But their guidance has helped us, I think, as a community, prioritize properly high-risk people. So our standby lists represent what the county, what the committees have come up with. So I'm very proud of the fact that we work together to solve that problem. because it's not an easy problem, I think, to solve. So I'll stop my comments there. We're just proud to be a part of the solution, and we hope to accelerate it as much as possible with the county. So.
Well, and thank you. And we're really proud to have, all that you have done for our community as well. You talked about getting the vaccines out and staffing. Is staffing an issue? I mean, with all those people that you are vaccinating, what about staffing?
It is an issue, and it's not, because you would be, this community, the town of Danville, the city of San Ramon, our police officer reserves, actives, the partnerships that we've had, at least with our vaccine clinics, and if you've gone to them, you see they run very smoothly. We have upwards of 30 volunteers that show up. We have reserve firefighters. We have CERT volunteers. This community that we live in and outside, and even, when I say our community, internally to the San Ramon Valley, but even outside, we have people that come to our clinics from all over to volunteer. And so it's an issue, but the amount of response has been not an issue. So we're always worried, but we've been very fortunate to have folks step up. And back to the fire board, they've given me a lot of leeway, and we've been hiring EMTs to be ready to vaccinate in case, Dr. Tzvieli says we need 10 people. We can show up, and we can, whether it's here or we'll go anywhere in the county, and we have gone everywhere in the county. So we're ready to go.
Well, you mentioned ready to go. So, and anywhere in the county. What about the people that are not mobile and cannot get to a vaccination site? What are we doing to take care of those people?
Yeah, that's a great question, and we were really proud to tell and work with the county again. They've been very easy to work with, to give us the opportunity to do mobile vaccines. As you know, we're an ambulance provider, so we're more EMS based than a lot of fire districts are, fire departments. So we were fortunate to be able to take our ambulances. We have reserve ambulances, throw everything we need, whether the county has, whatever they have, we can bring in all of our medical supplies too. And we can be a rolling mobile clinic. And we have done that. And we've done that right here. We've got every residential care facility, I believe, in San Ramon Valley has been vaccinated, not just because of us, but from a team perspective. And then they've given us the opportunity. We've gone to Richmond, Antioch, Pittsburgh, Concord. We are a rolling vaccination clinic, and we're super proud to do that, to go to these senior housing communities. And when we talk about equitable distribution, we're able to do our part in that as a San Ramon Valley, to make sure that we get to certain segments of the population that aren't mobile and are maybe challenged from a technology standpoint. We can get out there and do that. And we've done, I don't quote me on it, I think we've done about 10 of those to date, and we'll continue to do those. And that's another great thing, because I think you end up going into different communities and seeing the effects of your efforts, and our folks are really proud of that.
Yeah, no, that's fantastic. And it's good to know that you're getting out there and you're vaccinating, because I know that we've had, when you look at the number of deaths that we've had in Danville, the majority of them come from the congregated living facilities, and it's good to know that they are getting vaccinated. You mentioned a backlog, and you mentioned people that are on the list to get vaccinated. And I know that Dr. Tzvieli could answer this as well, but since we're talking to you right now, who are on your list to get vaccinated, and what does that number look like?
Yeah, that's great. That's another great question. Actually, we went from not having a big list and really trying to push to get a standby list, because as Dr. Tzvieli said, the first clinics, you're thinking everybody's going to show up, and you're just hoping you have enough vaccine. And then when you end up with extra vaccine, then we all go, okay, we got to reset. So they came out with a great policy. And then what we did for us, and I won't speak for the county, but for us, is we put together a banner on our website, firedepartment.org. And I don't know if I can share it out there, but if you go to firedepartment.org, there's a banner at the top, and you can either register by clicking on that banner. There's an email link, and there's a phone number. And what we did is we asked people, if you're in those high-risk tiers, to put your name on the list. And it's amazing. And it's just part of the problem. It's no one's fault. but it's amazing how many over 75-year-olds, right, that should have been vaccinated that end up on our standby list. And that's another part that's really important to us. We're able to take that list, and we have 1,300 people on that list now. And we're able to call on those folks and get them down there. Now, here's the problem. And, you know, it sounds easy, and I'm going to defend every vaccinator out there. It sounds easy that you're going to make phone calls, but when you need 30 people to come and you have a standby list, it takes us upwards of 300 calls, 200 calls to get people to answer.
Wow.
Because people think somehow like, and in their defense, this is new, right? But we'll call and people go, I'm sitting down to dinner. Can I come tomorrow morning? And you're like, listen, I need to get off the phone. So it's a difficult process. So we actually have a standby list of the standby list. So we call the day before of all of our high risk folks, over 75, all the tiers that the county has set forth. And we try to get them teed up so that it's easier. So we don't have these situations where you don't want to sit there with a vaccine, as Dr. Tzvieli said, and go, okay, and now I just need a warm arm. It happens, but that's what we want to avoid. So.
Yeah, that's got to be, I mean, but just to get out there and to be able doing that, what an effort that you've had to put in to be able to see this come to fruition to where all these people are getting vaccinated. Have you ever had any of your firefighters or your first responders refuse to get the vaccine?
Absolutely. We are just like the country, right? There's so much misinformation, sometimes overabundance of information and analytics. So we all overthink everything. But I'm proud to say this, we're up to 70%. And when we first started this, I was around 50 or 60. And suddenly I think what happens, and maybe this is happening out there, like I said, we're a slice of the pie out there, right? Let me wait to see if somebody grows a third eye. And then now I see, okay, you guys don't have a third eye. I'm in, I'm going to take the vaccine. Right. So we've seen that. So we've seen more, and it's too bad in one sense, but at least it's a positive push, because us being at 70% and moving up, it's important for people to see that we're still healthy, because I think that's the test, right? So that's where
right. Yeah, and I can see that. I mean, obviously it's like you're the test dummy, right? But what is it they said that they'd like to see more of the politicians get the shot first and the first responders second, because we can stand to lose a few politicians, but we won't go there right now. But anyways, but I want to go ahead and start talking to Ann for a little bit, Paige. And I'd like to welcome Ann is the CEO of the San Ramon Regional Medical Center. And from a perspective of the hospital scene, I'm sure you've seen quite a bit. And one of the things, Ann, that we see all the time is that we were told at first that it was based on the emergency rooms. It was based on the ICUs and capacity and all that. What are you seeing in the hospital?
So I'm very well. First, let me start. I'm going to do what Paige did. So I just want to say a quick note of thanks first to the county and also to the local fire district, because the partnership has really been tremendous. And I think the speed of adapting to the frequently changing guidance has been very, very important. And I think it's because everyone works really closely together. And so, I do really appreciate their constant support and partnership and collaboration. They've done an amazing job. As far as what we're seeing in the hospital, it's really been a great story over the last, I would say, 2 months. We did see that really significant surge from Thanksgiving through the year-end holidays. A lot of people obviously were traveling around the country, and so the spread really took off. A lot of meetings and gatherings in person, in closed spaces, and it just showed immediately in the hospitalizations. Hospitalizations across the county were, through the roof in the Bay Area, everywhere. And so I'm very grateful that over the last, really since mid-January until now, the COVID volumes have just dropped dramatically. And I think that's a testament to the vaccine efficacy and the speed of deployment. In our hospital, we're down to, a handful of COVID patients at any given time, under 5, I would say, that actually have COVID at any given time, which is where we were back in the spring, which is very encouraging. We do have we do have more PUIs, but we try to be very careful. PUIs are the persons under investigation, and we want to be very, very cautious and put people under precaution, even if they don't have, they don't test positive, just to be on the safe side. But in general, we're very glad to see the numbers have dropped dramatically and super manageable now, and very much something that is a really good sign. In the county, you heard that the positivity rate is under, I believe, 4%, and the hospital, it's now under 2% from what we've been testing of our outpatients and inpatients. And so that's really encouraging. We have plenty of capacity, both in the ICU and in inpatient units. And the number of ED visits we're seeing has dropped dramatically as far as COVID patients. So all in all, we're in a really good place. The hospital's doing really well. And we're all, we finally see a light at the end of the tunnel, and it's very encouraging to see that. I did kind of want to share something that's of interest, probably. You mentioned earlier the flu shot. This time of year, typically we would see, dozens of flu patients in the hospital. And this year we've had 0 flu patients.
Wow.
That's an indicator of how effective all of these measures are that we've been taking, the masking and social distancing. It really shows that, it prevents the spread of multiple diseases, and flu is another one of those. So that is pretty amazing. It's a striking difference from any other year in our history, I would say. And then also on the point of the flu shot, first of all, I want to still encourage people to get their flu shots every year. I don't want this to be something that they stop doing. But, if you compare the effectiveness of a flu shot, even on a good year, it doesn't get sometimes close to the 90% level, like what these, some of these new COVID vaccines have. So the effectiveness of the COVID vaccines is really high relative to what a normal or average flu shot would look like. And what I've found is, if I get the flu shot and then I get the flu anyway, it's still a milder version of what it would have been if I hadn't gotten the flu shot. And so that's what I want to emphasize also with the COVID vaccine is, even if it's not 100% effective, even if you get the disease with having had the COVID shot, you're going to have a much more mild response, or a milder version of the disease. And all of these vaccines are protective against hospitalization and mortality because of COVID. And that's really what we're trying to avoid. We don't want people to be so sick they have to go to the hospital and that they potentially pass away because of COVID. And all of these vaccines, regardless of which one, all the ones that have been given authorization, are able to protect against those, severe cases of illness. And that's so encouraging.
So, one of the things that I've heard and I've seen firsthand as well is, the flu shot, you don't usually get a reaction, and you're not asked to sit for 15 minutes and wait for a timer to go off to be observed and leave, right? So what is it with the COVID vaccine that creates such a reaction in a person when they get a vaccine like that?
Well, this is a different kind of vaccine than, the flu shot. The flu shot is not an mRNA vaccine. And so this is an mRNA. It does have a stronger side effect. I'm not a clinician, so I don't want to pretend to be one. But what I've heard clinicians also, explain is that this disease is also a very serious disease. So the vaccine that protects against it is going to have some stronger side effects, but that is still worthwhile because the side effects are still much more preferable than having COVID itself. And so there are some side effects. And what I have found is that it's generally the second dose that causes the stronger side effects. The first dose is much milder than a second dose. And I'm curious to see how this new Janssen vaccine is with the one dose, if it's going to have a similar of side effect. It seems like it's lower and less strong than some of the others, but I try to remind people that you're getting vaccinated first for yourself to protect yourself, but also it's the right thing to do for your community. And so it is not something that you're going to enjoy 100%, but it still feels so good to be a part of this national effort to protect the community. And so a few side effects are worth it to be able to be a part of that effort.
So, one of the things that I think has been down as well from what I recall is emergency room visits.
Mm-hmm.
People are afraid. They're afraid to go into the emergency room. So if, a person has chest pains and is experiencing that, they're afraid to go to the emergency room because of catching COVID-19.
Yeah.
Have your emergency rooms visits been down, and what are your protocols in place for that?
Yeah, it is really worrisome. Similar to what Chief Meyer said, we know that there are people still having medical emergencies who are not seeking care for them because they're afraid. And, obviously COVID is a serious condition and you want to be protecting yourself. But if you are having chest pain, if you're having a health issue, that is a serious and imminent problem that needs to be addressed. And so we really want to encourage people to know that it is safe for them to get healthcare, and not just for those emergency conditions. It is safe to go to your doctor's office. It's safe to go to the hospital for preventive care. You should be getting your annual mammogram. That is so important. All these things still need to be happening because our health is so much more than just this one condition. I think that it's really important for people to know that it's safe to go get healthcare. We have separate care pathways for our COVID positive patients. We use our PPE very effectively. The good news is that the hospitals have been using PPE for years and we know how to use it. We're very well trained. All of our clinicians are phenomenal individuals, and they've been very well trained in how to protect their patients and themselves. The vast majority of our staff have been vaccinated. And so that's another, way to have extra, provide extra confidence to the patients that they're not at risk when they come to the hospital. And as was mentioned earlier, we're also starting a pilot process to start vaccinating our inpatients who are eligible. So those over 65 or those who are going to be discharged to a congregate living facility, so that they also can have that protection when they go out into the world again. It's a process that is new for us, but I know that all the hospitals are trying it out and learning how to do that as well. So it is really important. I will say that we've heard a lot of really awful anecdotes of individuals coming to the hospital days after having severe pains, and then, they've had an appendix burst or, other, much more acute conditions that if they had come a few days earlier when the symptoms started, the situation would have been a lot more manageable. Same, I've heard from surgeons who, see people come in with, significant sized tumors that they felt months ago and they just didn't feel like they wanted to go in and have them checked out. And, every day counts when you're dealing with something like cancer or these acute care conditions. And so I just really want to emphasize that you please don't put off, your healthcare. You are safe going to these healthcare facilities. I think that, for me, I feel safer walking around my hospital every day than I would maybe going to a lot of other settings. And so it's really important to inspire confidence for people to get their healthcare.
That is so important, and it's so important, and what an important message to put out to the community as well, because I know there's a lot of fear and there's a lot of people that don't want to even going to the grocery store are afraid, and it's something as simple as that. You also mentioned vaccines. Your staff and your healthcare workers have been vaccinated. What's the percentage of them that are vaccinated right now?
I believe it's over 80%, and then a number more planning to get it in the coming weeks as well. So it's been very well adopted. And I think that in general, the speed of deployment has been really good. So, just to illustrate the point, the Pfizer vaccine was given emergency use authorization on December 11th. Our county received the first shipment on the 14th, and we started vaccinating our staff on the 16th.
Wow.
And, it was so inspiring to see so many people, volunteering and almost, clamoring to be the first to get it. So we've really mobilized quickly, and the vast majority have been really, really eager and grateful to get it. It almost feels like a weight has been lifted off their shoulders because they've been having to deal with treating COVID patients and facing this every day without, that extra level of armor and protection. And now having the vaccine is just, it's a great relief. Of course, I always want to mention that, we still are masking, we still follow all the same protocols. And so it doesn't mean that you just get to throw caution to the wind. We still follow all the same precautions we always do, but it is nice to have that extra level of shielding.
So none of them have grown a third eye, as Paige mentioned. So
no, not yet.
That's good to know. That's good to know.
Yeah.
But what type of reactions are you getting? Or have you had anybody that's had a severe reaction that's had to been hospitalized?
No, we haven't had any anaphylactic shock or any sort of severe reactions. A lot of the common ones are a rash or swelling or pain at the site of injection. Some people develop fevers. These are mostly after the second dose, sometimes the first, but fevers, some chills, or general level of fatigue and weakness. Kind of like a mini flu for a day or two. But it all tends to resolve within about 48 hours. There are some lingering reports of longer term side effects, but those are kind of the main ones that I've seen. Oh, and headaches sometimes, but they've all been manageable. I haven't seen anyone come to the emergency room for care after a vaccination due to side effects. I would defer to the county health officer if there's any reports at other hospitals, but we've been really fortunate about, nothing severe in our case.
And I think you mentioned as well, it's the drop in a bucket of symptoms as opposed to getting actual COVID. So that's a good thing to know as well. So people aren't afraid to go out and get the vaccine and make sure that they get vaccinated.
Yeah.
So let's go ahead and let me ask you one more question before we get into questions. What about people that, once you get vaccinated and you're out there and you feel, like this sense of, accomplishment and you're secure now and I don't need to wear my mask now. I don't need to hand sanitize my hands to where they're so dry that I can't even, my fingers are dry from it. I don't have to do that anymore. I mean, what, now I'm vaccinated, no more masks, no nothing. I mean, what do you think?
I know people would love to get back to that place, but it's just, we can't let our guard down yet. I think that we've been through a lot of cycles of concern and relief over the last year. Like you were mentioning how when we started last March, it seemed like this was going to be kind of a short-term thing, and by summer things were going to be normal. And in our area and in our hospital, we really weren't impacted very much by COVID throughout the summer, and they were very low volume. So it was, it felt almost like, okay, we're going to get through this. It's going to be super easy. But then the surge that happened in this winter was dramatic and very serious for the whole state, and certainly in our area. And so, that reminds, it should be a reminder to people that we can't let our guard down. We can't stop protecting ourselves. The most important thing, if you want to support local healthcare workers and local essential workers, the most important thing you can do is keep wearing your mask, keep following the protocols that are issued, keeping your distance, and get vaccinated when it's your turn, because all those things are the way that we can get to that place of normal life again. But we're not there yet, and there still is some uncertainty about things like the variants, and to a certain extent, we're such an interconnected world now that even if things are great in Contra Costa County, we have to look outside of our little our small world and see that there are places where there's a lot more spread happening and where there's a lot of risk. And since there's always going to be travel, we have to be in a place where the whole where everybody is in a more protected situation before we can really let our guard down. So please, I know it may feel unfortunate to keep having to do these things, but it's the most important thing we can do.
And it's kind of that word of what does normal even look like anymore? It kind of feels like, right? So
Yeah.
if you all don't mind, I'd love to open it up to questions. One of the things that I've noticed as well is Diane Friedman has let me know that she's having a difficult time trying to get questions off of the internet. Here we are, if we were live, people could step up to a podium or raise their hand, and unfortunately we're not, so it makes it a little bit more difficult. But I do have some questions that came in on email, and if you're still willing to email a question into the link that was provided, please do so, and we'll try to see what we can do to answer those questions the best we can. One of the things that I wanted to ask you as well is the Bay Area has 10 zip codes prioritized by the state for vaccines, and this is something that just hit and is brand new, and that Governor Gavin Newsom announced on Thursday. And I was just curious to find out, the only county that it looks like here in Contra Costa, the only city I should say, is North Richmond. Will that also affect our distribution, Dr. Tzvieli, of the vaccines to get out to to Chief Meyer's group and also the hospitals and so forth?
It probably will. We don't know for sure, but the state did say that they are prioritizing 40% of vaccine to go to these zip codes. So I think de facto that will mean a little less vaccine for everyone else. So I do think that is true. And I'm hoping it's only a very temporary thing, that by April, there'll be enough vaccine for really everyone who wanted to get it.
And the reasons that they're focusing on those areas are?
Two reasons. One is harder hit areas which are called low HPI. That's how they're prioritizing this. Have had a lot more COVID. So the idea is interrupting COVID in those communities will have a bigger impact. And I think the other is equity. If you look at even our own county, certain towns are in 30, 40% vaccination rates. Others are still around 12, 13, 14%. So there is different access in terms of transportation. There's a digital divide, ability to access sites. So I think those are, I mean, this is not our decisions, it's the state decisions, but those are the reasons that they've communicated to us.
So for instance, if somebody from Danville wanted to go to Richmond and get a shot, they wanted to get their COVID shot, would they be able to do that, or you have to be a resident of that particular city?
It's a really good question, and I'm not sure how the state is actually prioritizing that de facto. You know, will they give residents of that city their own individual access codes to go into My Turn? They haven't told us exactly what their plans are, so I don't know. But I can tell you that until now, many people from all over the county have driven to all over the county, and the same may be true also when we open the San Ramon site. People from other parts of the county may end up in DVC San Ramon. So that's been true throughout the pandemic, that people have really gotten on as many lists as they could and gotten their vaccine wherever they could.
You know, I think the hard part for all of us to understand is, you know, when we make decisions, it's based on Contra Costa County. And people look at it like, you know, Danville, we're doing our part, we're wearing our masks, we're getting vaccinated, we're doing what we're supposed to do. But that doesn't put a shield around the town of Danville. And unfortunately, there are people that come from different areas and different cities that will come and go to a restaurant or just shop or whatever it may be and possibly infect people. So it's a really slippery slope when you start talking to people about, you know, we need to get everybody vaccinated, and you know, well, Danville's doing their part. Why can't we open sooner? But I think for all of us to understand that is because we are not just isolated in one certain area, that we do move around, and that other people do come into our communities that could bring the spread of the virus as well.
Can I say something real quick?
Go ahead. Oh, absolutely.
I want to give Dr. Tzvieli a lot of credit, because I think two things need to be said about that question. Number one, we're vaccinating. Our clinics that are right here in the San Ramon Valley, roughly about 70% of the vaccines we give are not residents of the San Ramon Valley. So from day one, the county, we have worked this as a regional effort. So I know the numbers and the equity issue is very important to everybody, but I ourselves on the back a little bit, because I think that the thought process that somehow we're vaccinating and we're focused on San Ramon Valley, we're focused on the county because we're working with the county. So when you see these clinics in San Ramon, we have done, like I said, 70% outside. And I'll just give him another hit. I mean, another pat on the back, and because he's not going to do it himself probably. We are one of the #1 producing counties for vaccine. I mean, in the state. I mean, this is, you got to understand, it's so, I'm very proud to be a part of a county where we're at the top of the list in the entire state. So I just want to say those two things.
And I'll just return the pat on the back to both Chief Meyer and to Ann. I mean, I think partnership with San Ramon Fire has been fantastic. They've done everything we've asked them to. They've offered extra help that we didn't even think about. That was their idea. They've gone all over. They've gone to nursing homes. They've gone to low-income senior housing. They've gone to people's homes. And San Ramon Regional has been a really great partner. They were early adopters in vaccinating. They're one of the earliest hospitals to vaccinate patients before they're discharging them. So they've just been fantastic to work with both of the organizations, and I think you all as a community should be proud.
Yeah, that's good to hear. I'm proud. I'm very proud. So I got a question here from Dave. There is information that the county is concerned about the state rollout program and how best to schedule appointments and rollout. Can you comment on this?
Yeah, the state has contracted with Blue Shield, which they're calling the TPA, or third party administrator, to create a new scheduling system. We think we have a really nice thing worked out, and you know, with our partners and our sign up on the county website and our call center and everything. But they're asking everyone to switch over to My Turn, which is what their sign up system is called. We are in the third wave of that. So right now they're doing wave 1 counties. Wave 3 was supposed to be around the 15th of March, but it seems to be getting delayed to around the end of March. So we're still waiting to hear a lot of details from Blue Shield about what that will mean. We do know that everyone who's had a first dose and is on the schedule to get a second dose, those appointments will be honored. At this point, we are recommending to people to sign up in both the county site and the My Turn site. And if you sign up with the My Turn site and say, here I am, this is my name, this is my address, this is which tier I qualify in, then they're supposed to email you when appointments in your area become available. So we think go ahead and hit them both, try to sign up on both, see which one comes through first for you. Don't take 2 appointments. Once you get one, cancel the other one. But we do think it's worthwhile to do it both ways. We're still waiting on a lot of the details. We do have concerns because we think we did it pretty well, but we understand the state wants to go to a uniform system. To some degree, that's going to help them when they talk to the federal government about allocations of vaccine. If they can put their numbers together efficiently and say, this is what's going on in our state, we can draw down more vaccines as a state that way.
Such an interesting concept. And it's just, I think the message is so clear: just to get out, get vaccinated, protect yourself, continue to do what you've been doing, wear your mask, sanitize your hands, those type of things. What about, we're talking about getting into the next tier, and that's an exciting thing for a lot of us. I mean, the summer's coming and people are out and about. I know that our downtown is more abuzz right now because we've been able to open up our parklets again and people are outside at restaurants. And but what about the next tier? It's coming up in about 2 weeks, I'm assuming. Do you still see that happening, or are we still crossing our fingers, or what are you thinking there?
I do see that happening. I don't know if it will be 2 or 3 weeks, but if the numbers keep trending down, it will be around that time period. The state has also announced that I think we've given away close to 10 million doses statewide. They've announced that once we hit 2 million doses for the lowest quartile HPI, then that's an equity metric that they have, that they're gonna change the criteria and make it even easier to get into the red tier. So I don't know which one we'll hit first. I think we're probably gonna hit the normal number first, but I expect that we'll be in the red tier about 2 to 3 weeks. It would surprise me if it took more than 3 weeks. And I do think that we'll continue to move down the tiers. Everything I'm seeing now is that it's trending in the right direction. So yeah, I'm optimistic.
Okay. Jeff Gillette is with us today as well, and he's kind of in a silent mode right now, but I'd like to bring him on and ask him if he's received any questions via email, since I'm not able to see them right here. Hi, Jeff. Welcome.
Hello, and thanks for bringing me on. First off, let me apologize to all of our viewers. When we set up this Zoom meeting, the idea was that you would be able to enter your questions in the chat mode. What we are now finding out is that we missed checking a box somewhere along the way, and so the chat mode isn't enabled. But if you go ahead and send an email to towntalks@danville.ca.gov, we will try to get the question asked today. If we can't get it in during the course of the remaining few minutes of the program, I will track down an answer and I will respond to each one of you. So again, my apologies for that. Next month when we're back, this will be running much more smoothly, and you'll be able to ask your questions in the chat, and the mayor will be able to take care of that for you. So far, we haven't gotten any emails about that. I did have a question for Dr. Tzvieli in regards to the way that things change and the information coming down from the state to the county, which is then disseminated to the local level. How has the communication been for you guys at the county coming from the state?
That's a good question. I think we meet with them several. There's usually there's always a Wednesday meeting, and then often there's like a Sunday night, half-hour notice, get on this meeting. So we meet with them several times a week. There's such, they're trying to respond to 58 different counties, some of which are very urban, others are more of a mix like us, others are very, very rural, might have 20,000 people living in them. So that there's a huge variety of approaches that they need to take into consideration, issues of fairness, issues of equity. So they work hard at it. Sometimes we wish we had more notice. Sometimes when sometimes they'll tell us, and about an hour later they'll make a press release, and so we don't have a lot of time to prepare always. But I know they're under a lot of pressure and a lot of changing conditions as well, and I have a lot of sympathy for that, because we've all been sort of in that mode for about a year now. But they're trying hard, and they're being lobbied by so many different interest groups and organizations. So I think it's hard for them, but we appreciate the partnership with them. We're always trying to get more vaccine for our county because we want to get our community protected faster, obviously.
Diane has handed me off a couple more questions here, Mayor. There's one each from Brian and Bonnie Walker. One's for Dr. Tzvieli, one's for Ann Lucena. For Dr. Tzvieli, should an asymptomatic adult get COVID tested? And if so, how often?
That's a great question. And you've probably seen conflicting messaging on this over the course of the pandemic. At the beginning, we said, don't do it because we didn't have enough testing. And then we had a lot of testing and people weren't getting tested. So we started saying, yes, if you're asymptomatic, go ahead and get tested. And then we got overwhelmed and said, actually, no, we need all the testing slots for the people with symptoms. I would say right now, if you're just a normal person who's not working in an essential sector, I don't think you need to get tested. If you are, working with the public in some sort of situation where you're coming into close physical contact with the public, let's say you work at a restaurant or you're an emergency worker, we will happily test you if you want. You can sign up through the county website. There's lots of testing available these days. And I would probably do that about once a month if I was someone who was interacting with the public, regardless of whether or not I had symptoms, at least until I was fully vaccinated. It's about 2 to 3 weeks after, 2 weeks for the Moderna or Pfizer, and 3 weeks after the Johnson & Johnson vaccine that we consider full immunity to be in there. So about 2 weeks after my second dose of Moderna and Pfizer, or 3 weeks after my one and only needed dose for the Johnson & Johnson, is when I would consider myself largely protected. It's not 100%, but it's largely protected. And at that point, I don't think I would need to continue that asymptomatic testing. So.
For Ann, the question is, why is a COVID vaccine not mandatory in order to work at your hospital?
So far, I don't believe any hospitals have made it mandatory to get vaccinated. As you can imagine, we're only a couple months into this. I do think that at some point it's possible that this will become a mandate across many hospitals, but we still have to respect a lot of the individual's right to choose. This is still an early, part of the development or the rollout process, and it's just received EUA or emergency use authorization less than 3 months ago, essentially. I also would share that, some of the individuals, they might have a reason that they're waiting, if they're, expecting. I know that there's been a lot of different discussions about pregnant women and getting the vaccine or not. Most of the OBGYNs on our medical staff do recommend it, but I know that that's been something that are hesitant about, or another reason might be that if someone's had the COVID actual illness, they don't necessarily need the vaccine right away afterward. And so there are some legitimate reasons why people are choosing to wait in some cases. So we're not taking a stance that we're requiring it at this point, and I don't believe anyone else is, but we strongly recommend it. We want to encourage everyone to do it, and it's something that I who's been vaccinating has seen as their peers get it, they're much more likely to get it. And we have a lot of people who get encouraged by seeing someone else on their team get it and that they're doing fine, and then they're more willing to do so. So I anticipate it's going to be, not very controversial for people to continue just getting without having to make it a mandate.
I've got one last question, Mayor, if we still got time.
Absolutely.
All right, this one's from Claudia Bain. Claudia says, I was lucky enough to receive my vaccine on Monday at Oakland Coliseum. The process was very efficient and CAL FIRE and FEMA was great. Can you address the claim that thousands that received the vaccine on Monday prior to 2 p.m. have received the wrong dosage? And if so, what is being done about that?
This is Dr. Tzvieli. I think that was overblown. And not accurate, really. I've looked into that and spoken to some people at the state. The syringes that they were using were leaving a little bit in the syringe, but they've done the testing and the dose was adequate. So I don't think anyone needs to go back and get another dose. And I do think they've given better instructions to the crew on the ground on how to draw it up. Part of the issue is that there's different kinds of syringes out there just because there's a shortage of those. So some of them draw up a certain amount. And with the bottles now, we have to use 5 out of the 6 doses. We have to use 1 syringe, and 1 out of the 6, we have to use the other syringe just to get it right. But I think, and I've seen the guidance from the state, the people who were dosed adequately, and it's considered a valid dose. And there's nothing that you need to do as an individual.
So those are all great questions, and we so appreciate it. I know that we're working at 10 o'clock right now, which is an hour into our show, which I promised everybody we'd be wrapping up in an hour. I want to thank our guests so much for being here today. Such a valid topic to be discussing, and from 3 individuals that have made us really proud to be a part of this community, and also helping to keep all of us safe. So I thank each and every one of you for being here today. I also encourage any of you that have questions, since we had a slight glitch in the system, if you still have questions of any of the guests today, feel free to email and we'll be sure to get the response back to you. Like I said before, this is our first Town Talks, and we're really proud to be able to present these topics of interest to our community. Our next show, as I mentioned earlier, is going to be the first Friday in April, which will be April 2nd. We will be discussing local control, a big issue that faces our community at a regular basis. And now, especially with all of the new bills that have been introduced, it is more important for all of us to know what the future is for all of us and what type of control we'll have of our own communities. So making local decisions is really important to Danville. That's what makes us a great community and keeps our small town atmosphere and outstanding quality of life. So we look forward to seeing you on April 2nd. Thank you once again to our guests. And in closing, stay positive, test negative, and we'll see you next month. Have a great day, everybody. Bye-bye.
Bye. Thank you.